Infertility in women. Infertility is defined as the inability to conceive after 1 year of unprotected sex. It affects both men and women, but is most often diagnosed in women. In this article, we'll take a look at what causes infertility in women and some of the treatments that are available. There are many possible causes of infertility in women, including hormonal imbalances, ovulation disorders, uterine abnormalities, and fallopian tube blockages. However, with advances in fertility treatments, more and more women are able to overcome infertility and have healthy babies. There are treatments available for infertility, so don't give up hope. With the right treatment plan, you can achieve your dream of becoming a mother. Infertility can have a profound emotional and social impact on a woman. The sense of failure, isolation, and grief can be overwhelming. Many women feel that their femininity has been taken away. It is important to remember that you are not alone. There are also many resources available to help you through this difficult time. If you are struggling with infertility, reach out for help. Talk to your doctor or a counselor. You don't have to go through this alone. If you're trying to get pregnant, you need to know about ovulation. It's when your ovary releases an egg, or ovum, into your fallopian tube. The egg then travels down the tube, where it can be fertilized by a sperm cell. If everything goes according to plan, the fertilized egg will implant itself in your uterus and grow into a baby. Ovulation usually happens about midway through your menstrual cycle. If you have a 28-day cycle, you'll probably ovulate around day 14. But it can vary from woman to woman and even from month to month. So if you're trying to get pregnant, it's important to pay attention to your body and know when you might be ovulating. There are ways to tell when you're ovulating. One is to keep track of your basal body temperature, BBT. This is your temperature when you first wake up in the morning. It's usually a little lower than it is the rest of the day. But during ovulation, your BBT rises slightly and stays elevated for several days. There are many tests that can be done to determine if a woman is infertile. The most common test is the pelvic exam. This test can help to determine if the fallopian tubes are blocked or if the ovaries are not producing eggs. Other tests that may be done include a blood test to check hormone levels, a hysterosalpingogram to check for blockages in the fallopian tubes, transvaginal sonography, to check for endometriosis or other problems with the reproductive organs. There are a number of ways to treat infertility in women. Some common treatments include fertility drugs. These drugs can help to stimulate ovulation. Intrauterine insemination, UOI. This is a procedure where sperm is inserted directly into the uterus. In vitro fertilization, IVF. This is a procedure where eggs are fertilized by sperm outside of the body, and then the embryos are implanted into the uterus. Role of men in infertility in women. It's no secret that women are often the ones who are blamed for infertility. But the fact is, men play just as big of a role in fertility as women do. In fact, according to the American Society for Reproductive Medicine, ASRM, about 1/3 of infertility cases are due to male factors. One of the most common is a low sperm count. Other male fertility issues include poor sperm motility, the ability of sperm to swim towards an egg, abnormal sperm morphology, the size and shape of sperm, and ejaculation problems. All of these can make it difficult for a man to impregnate a woman. There are a variety of lifestyle choices that can impact a man's fertility. For example, smoking cigarettes and excessive alcohol consumption can also lead to fertility problems. Marijuana or cocaine can also have a negative impact on sperm quality. Food to avoid if you want to get pregnant. One should avoid foods with excessive fat like fried and greasy foods, as well as things like coffee, tea, white sugar, white flour and flesh. Eat more fruits and vegetables. Take natural supplements available over the counter. Lose weight with diet and exercise. Above all, stay happy and stress-free, always smile. We wish you best of luck. Be a mom soon.